Chapter 4 of the 2025 Guidelines on Vascular Trauma is dedicated to thoracic vascular trauma. Up to 90% of blunt traumatic injuries of the thoracic aorta are located at the thoracic isthmus due to the mobility in the aortic arch compared to the fixed descending aorta. The transition zone is vulnerable at blunt force trauma and rapid deceleration. Such injuries are mostly asymptomatic and only discovered when a high clinical suspicion leads to imaging. CT angiography is recommended for the diagnosis and characterization of blunt thoracic aortic injury. Treatment strategies are individualized depending on other injuries and the grade of aortic injury. These can be classified as follows. ESVS grade 1 is an injury confined to the intima of the vessel wall, but with a normal external wall contour. ESVS grade 2 involves an abnormal external wall contour or external wall disruption with contained hemorrhage, for example, a pseudoaneurysm. ESVS grade 3 marks a complete wall transection with a free rupture. In patients with ESVS grade 1 blunt thoracic aortic injury without concomitant severe traumatic brain injury, non-operative management with blood pressure control and follow-up imaging is recommended. In case of external wall contour abnormalities, such as a pseudoaneurysm, TEVAR should be considered. TEVAR is performed preferably after 24 hours of stabilization of the patient, unless high-risk features warrant urgent treatment. Patients with grade 1 aortic injury who also have brain injury may be considered for TEVAR, as blood pressure control is not always feasible. In case of a grade 3 injury, immediate repair is recommended. TEVAR is the recommended strategy, unless resources are limited, or in young pediatric patients with unsuitable anatomy, where open repair may be the only alternative. The guidelines further provide recommendations on TEVAR-related strategies, such as intraoperative heparinization, stent oversizing, follow-up of these injuries and the consideration around left subclavian artery revascularization. This video has provided a quick glance at Chapter 4 of the 2025 Clinical Practice Guidelines on the Management of Vascular Trauma. To learn more about each topic, please read the full guidelines through your regular channels. We thank you for your interest in the ESVS guidelines and hope to see you back for more.